Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I wanted to talk a little bit about your HR5 results. Now, what we test for are 5 of the worst red complex bacteria. Those are AA, PG, TF, TD, and FN. Now, these bacteria live in a lot of people's mouths and are passed down genetically, but some are really, really terrible, and some show up as high on all 5 categories for patients, which means they're really, really high risk for not only gum disease, but also for other systemic complications. So AA isn't very common, but that is something that's hereditary, and we test for that. The main worst ones are the PG and FN. And what those do is those live below the gum line. So those are harbored in gum disease. Now, when we test for those, depending on your levels, we test for high, moderate, or low levels. If you're high in those are related to infertility, both in men and in women. So FN can affect your ability to have an egg transplant, your ability to build a uterine lining, or even to have the egg implant in the uterus. And the PG can affect sperm motility, both decrease arginine, which really affects the quality of our reproductive system. So if you're having battles with infertility, I encourage you to get tested for that. PG and FN also are very readily transferred from the bottom of the gum pocket, and every time we swallow, where's it getting dumped into? It's getting dumped into our gut. So these will get harbored in the gut, and if you already have leaky gums and leaky gut, what do you end up with? You can end up at high risk for colon cancer, pancreatic cancer. They're finding PG and FN in those types of cancers in the gut when they're doing some of the surgeries. That's really terrible. PG and FN also cross the blood-brain barrier, and very few things actually can. And that can lead to Alzheimer's and dementia, especially if there already is a hereditary history of that. And usually what's hereditary is the transference of a lot of this bacteria. So you definitely want to make sure you're not high in any of those bacteria, but especially those 2. Those are the worst ones. Now, what happens when you get a treatment plan back? We are going to go over with you your levels, and it comes back with a specific test. Now, some can be remedied with just zinc lozenges. That can help suppress some of the milder of the red complex bacteria. A lot of them need to have scaling and root cleaning, where we smooth down the roots. We decontaminate the pockets with ozone and with laser. And then we give you supportive products. And I'll go into those in another video. So when we're tested for these 5 bacteria, if you are high on PG and FN, a lot of times we recommend scaling and root cleaning, laser supportive therapy, ozone, and some other products we can use to keep that bacterial load suppressed. One of the things we like to use to suppress them, because they are such bad bugs, is oral antibiotics that are a low dose that are specific to killing off those types of bugs. After you finish that regimen and the scaling and root planing, we can do supportive therapy with our products, or something called PeriProtect trays, which is actually our custom-made trays with a special gel that not only has a little bit of antibiotic in it, but also has a peroxide-based product in it that helps keep the gums having the medicine delivered below the gum line and held there, so you're not constantly just swallowing it and dumping it into your gut or having it diluted in your saliva. And you wear those for about 15 minutes a day. I also like to use, in addition to the deep cleaning, oral biofilm removal, which is a gentle removal, usually using sodium bicarbonate, where we flush out the pockets and smooth the roots with a gentle air abrasion and water with powder mixed in it that is really, really effective at decontaminating the sulcus, especially when it's mixed with ozone. So in addition to scaling and root cleaning and the PeriProtect trays, whenever you're back in for supportive therapy and maintenance, we also use the ozone, and we do an oral biofilm removal where we can flush out the pockets with sodium bicarbonate powder that's really gentle. It smooths those root surfaces out and flushes out the bad bugs, also when it's mixed with ozone. So we do that whenever you're in for supportive therapy. And we can also give you a variety of products, including oral probiotics. Now, you don't want to swallow them. You want actually the oral probiotics to establish the oral microbiome and the good bugs in your mouth. The gut's a whole separate issue. So we give you these tablets that you can chew and dissolve them in your mouth so that after we've thoroughly cleaned you, we can focus on rebuilding back colonies of those good bacteria instead of the bad ones. So if you're worried about a family history of gum disease, heart attack, diabetes, dementia, or different cancers and other autoimmune diseases, I would encourage you to explore getting some of the salivary testing done so you can find a specific remedy that's right for you. So come on in and get tested here at Moonlight Beach Dental.